The views expressed on the NCS podcast are solely those of the hosts and guests and do not necessarily reflect the opinions or official positions of the Neurocritical Care Society. Hi, and welcome back to the NCS podcast. This is Lauren Kaufman. I'm a neurointensivist at Temple University in Philadelphia. And today I'd like to welcome onto the podcast author from a recent Currents article, Dr. Yalcin, who's a neurointensivist at Boston Medical Center in Brighton. And she will be discussing her article, Virtual Reality for Neurorehabilitation, Mechanisms, Modalities, and Clinical Applications. So thank you so much for joining us.
Thank you for having me.
So, this is everything technology is booming in medicine. So before we talk a little bit about the virtual reality equipment and technology and how we use it in medicine, I just love to hear about how you learned about it and why are you interested?
Well, I first came across VR in a neurorehabilitation literature. At first, it felt more like a novelty from gaming or entertainment, not something you'd expect at the bedside. But the more I read, the more I saw the real neuroscience behind it. And what fascinated me was that you could digitally recreate tasks patient can't yet do or can't even safely do and still get their brains practicing those movements and cognitive skills. That's how I became interested because I can see the potential in their ICU.
Awesome. And I know you've been writing these articles for Currents on kind of technology. Do you have any special training in this or is it just an interest?
Oh, just an interest. I don't have any formal VR training, but it would be great to learn it. I don't think there is like official courses in regards to that, but it can be applicable soon, I think.
Awesome. So before we talk about what's available, what kinds of VR therapies exist, why don't you just tell us a little bit about the science behind how VR works?
Oh, sure. Well, the science behind VR and the brain is really about how multisensory input drives the plasticity. So, when you would put someone in VR, you're giving the brain coordinated visual, auditory, and proprioceptive cues that feel real enough to engage the same neural circuits used for movement, attention, and spatial planning. So, it's just not a screen in front of your eyes, it's more like a way tapping into the brain's natural learning systems. So, because it feels real, the brain starts strengthening and reshaping the connections it needs, and which is why it can help guide people back towards recreating the healthier patterns in the brain after an injury.
Cool. So what about the concept of cortical reorganization? I think you touched upon that in your article.
Yeah, sure. Yeah, I actually the same idea. The VR gives the multisensory input, visual, auditory, and proprioceptive, and that combination helps the brain to reorganize after an injury. So, for example, in stroke, you sometimes see abnormal activation on the non-injured side as a compensation. So, the VR-based training can help shift activity toward more normal and contralateral patterns. It's a way of guiding the brain toward more efficient connections.
I think one example that used in the article is mirror therapy. Maybe you could just describe that to us.
Yeah. So think of a traditional mirror therapy where you place a mirror next to the healthy limb. So the brain sees two working limbs. So VR basically supercharges that. So with a headset on, a patient can see their affected arm moving smoothly, even if they physically can't do it. And that visual illusion activates the mirror neurons and motor pathways, kind of like nudging the brain to reconnect those circuits.
And one thing that I thought was really interesting was the role of the dopaminergic pathways. It's something I totally makes sense, but I hadn't thought about how it would play a role with VR. But could you explain that to us as well too?
Yeah, actually, that's the fun part of VR, I think, because the gamified VR experience says the experience that patient have stimulate reward pathways in the brain, especially the dopaminergic systems, and it increases the mood and the motivation. And as we all know, in the rehab, motivation is the number one thing the patient needs. So that's how the VR works in the dopaminergic pathway by improving the motivation and the mood.
Awesome. Now, there's different kinds of VR, right? So I think you mentioned an article, there's immersive, there's semi-immersive, and then there's not immersive or hybrid. Could you just tell us a little bit about what kind of technology is required for each and what that looks like?
Sure. Well, I'll start with the immersive one. It's the full headset experience. It's head-mounted displays, motion tracking, and sometimes they even use haptic gloves or exoskeletons. This feels incredibly real and is great for motor tasks and special navigation and stimulating the daily activities. Semi-immersive VR is when you still use a display and motion sensors, but you are more aware of your surroundings. As actually the semi-immersive VR, the rehab teams like this because the patients remain grounded and clinician can easily intervene. And the non-immersive ones are the VRs without the headset. It's when someone interacts with the virtual environment on a regular screen. For example, we give a computer monitor, tablet, or TV, and then instead of being inside, you just look at the TV. They're simpler and more accessible than the full VR headsets and easier to use with many patients. While they don't create the same fully inside the world experience like the immersive ones, they are still very effective.
And do you have any examples of some evidence, or I'm sure there's really limited trials that have looked at this, but just tell us a little bit about what we know about how we can apply these technology to improving patient outcomes.
Yeah, I mean, there's a surprisingly strong body of work I was not expecting, showing that VR can help with balance, gait, and upper extremity function, motility, and strength. So there's actually a paper from UK. They did an umbrella review of 41 meta-analysis that showed benefits across multiple motor domains. But is there a caveat? Yes. The overall quality of evidence is still variable, and we see VR more as a valuable tool adjunct to the traditional therapy rather than a standalone treatment. But for the cognitive rehabilitation, there is also studies shows improvement attention and memory and mood. So what it shines, I think, mostly in cognitive rehabilitation because you can recreate a complex real world environment for the patient, like a kitchen, a grocery store, even driving without any risk to the patient. So it's a fantastic bridge between therapy and real life. Against different studies use different tests and measures, so the evidence is promising, but still heterogeneous.
Great. And I guess, a lot of what we're talking about is how VR is used for rehabilitation, which typically happens when people are almost out of the hospital or have moved past the hospital or acute phase. Do you think there's any applications for using this in the ICU?
I think that's my favorite part of VR because, as you said, we usually think rehab begins once people are out of the ICU, but VR is actually starting to push that boundary. So there's a platform called NRIC. It's an early neurocognitive rehabilitation in intensive care. Basically, it consists of a central processing unit, a flat screen TV, and a motion sensor on a medical cart that you can just move around in the ICU. It's designed to use for critically ill patients, even intubated patients, and it offers a very low demand cognitive stimulation. And by using this NRIC system, early studies found that it's safe, engaging, and even produces autonomic responses where they seen the heart rate was changing with the stimulation. That tells us that the brain is reacting meaningfully. And there are some other follow-up research suggests that it can improve the working memory and then reduce mood symptoms, which is also an impressive such an early intervention in the ICU. So I think we can use VR in the ICU. We can start the rehabilitation in the ICU with VR.
Now, I mean, I imagine that there's financial constraints towards this technology becoming more mainstream. Do you think there's other barriers to implementation, or is it mainly just financial?
I think there are, honestly. I think standardization is another problem because every study out there used a different setup. So it's hard to compare the results at this moment. Cyber sickness is something that we should think about. Nausea, dizziness, and disorientation can be limiting for the patients. And then we need to learn the systems, and the therapy teams need to protocol that will fit in the busy ICU units. And honestly, I think there is still a need for a more high quality RCDs, especially in the acute setting.
So I've never actually heard of cyber sickness. Is that something that's common, or is there any protocol to try and minimize developing that when people are using the technology?
I think they develop it mostly with the immersive one because you're in the real world and it can be very challenging for the patient. There's no strict protocol to limit it, but something to think about moving in the future.
Cool. So we talked a little bit about different applications for motor and cognitive rehab. Do you foresee any other uses or applications of this technology?
Oh, absolutely. I think this is also what is driving me to learn more about VR. I think one of the really exciting ideas is pairing VR with BCIs, the brain computer interfaces. So I can give an example. For example, imagine a patient who can't physically move their hand after a stroke or a severe injury. Even the hand doesn't move. If the hand doesn't move, the brain may still generate think, like we always tell the patients, think your hand is moving, hand is moving. So the brain may still generate the intention to move. So a BCI can pick up those signals and translate them into a movement of a virtual hand in VR. So that means that patient can actually see their virtual hand move and when they think about moving it. And that loop intending the movement and seeing it happening help these like motor circuits active. I think this is the fun part about the feature of VR and BCI together. And one of the things I think we can use VR is a tele-VR rehab. So basically, you can bring the therapy right into patient's home. And we know, after acute rehab, the rehabilitation slows down. And for people, extensive and consistent rehabilitation is really important. So a tele-VR rehab can make the rehab more accessible and help people practice consistently. And if we look further ahead, what also can help us with the disorder of consciousness. I mean, this is more feature, I think, but by showing simple but emotionally meaningful VR scenes and measuring brain responses, we can get a better idea of awareness in patients who cannot communicate. So it's still early days, but I think the possibilities for neurorehabilitation are really exciting.
I hadn't even thought about its use for using VR in terms of telemedicine. A lot of specialties are moving towards that, or at least it's helping us to give care to people in limited resource or rural settings. Do you know if that's something that's actually happening, using the tele VR, I guess, or is that just some future potential application?
I don't know if they're using it. I haven't heard about it, but I think it's a great potential for the future.
And I'm also just curious, have you actually seen any of this used in real life?
No. I personally did not use VR with patients yet, but I am genuinely excited about its potential. And the studies also mention how patients how engaging it is, and patient gets very motivated and they feel like therapy is less like work for them. It's actually a fun way to do it. Even without firsthand experience, it's easy to see how VR could become a powerful tool in the ICU rehab and cognitive recovery.
So you mentioned you don't have any formal training in this, but it's a super exciting new area of medicine. Do you have any recommendations for people that might want to learn more about this or ways for them to think about how they can apply it to their practice?
I think starting small is important. Maybe trying out non-immersive, more commercially available systems to get a feel of what's possible. And then, of course, partnering with the therapists is very important because they often have the most hands-on experience and can share tips with the intensivist. And then, if you're interested in an ICU and early rehab setting, you can look into the research platforms like the NRIC one that I mentioned before and see if it's feasible for you. And honestly, one of the best things I think is just trying the VR yourself. And you can see the cyber sickness part of that too. And experiencing it firsthand gives you a completely different perspective on what your patient might feel or how engaging it can be.
And, we talked about all the positives. I think the last question I have for you is, do you think there's any potential downsides to using this technology?
I don't think so, but I think we just need more evidence to make it more standardized. I do not see a downside other than just the cost of it and then making it standard all over across the units.
Great. Do you have any other final words about this you want our listeners to hear?
Well, I think people should look into it and try it themselves and then read the literature because I became excited when I saw the literature and I did not know actually this has been tried extensively. We still need more research studies for sure, but the potential is really, really exciting.
Awesome. Well, thank you so much. We appreciate you joining. We'll make sure we include a link to the article in the show notes. To check out this or other Currents content, head to currents.neurocriticalcare.org. And as a reminder, NCS offers free CME for select podcasts. Listen via the NCS Learning Center and complete a short survey to receive your credits. And don't forget to add us to your favorites so you never miss an episode.